First at 6 and live on the Channel 3 streaming news app. Up-to-the-minute information on the coronavirus.
Flattening the curve works. Flattening the curve has had some initial success here in Connecticut. But flattening the curve only works if each and every one of you take the social distancing very seriously.
Good evening. Let's get right to the numbers. Tonight we have 7,781 cases in our state, up nearly 1,000 from yesterday. 277 people have now died and more than 1,300 have been in the hospital. But the governor said there appears to be, we want to point out, a flattening of the curve. The governor also announced tomorrow they hope to start having numbers detailing the number of people who've been released from the hospital and are now recovering. As we look at the county by county map breaking down the cases, the hotspots in our state remain Fairfield and New Haven counties. During today's briefing, we also learned about a serious situation emerging in a nursing home in Milford. Channel 3 Eyewitness News reporter Matthew Campbell joins us now with something that affects so many families. Matthew?
Yeah, Dennis, this is a really stressful time because no matter where you live, if you have a loved one in a nursing home, you cannot visit them because of social distancing rules. And right now, some families are waiting to see if their loved one might need to move to a completely different home. And this is where we stand right now in our state. 38% of nursing homes have at least one case. The state confirms more than 40 people have been infected at the Golden Hill Rehab in Milford. And this is exactly what the state wanted to avoid when it unveiled its plan to dedicate specific nursing homes exclusively to coronavirus patients. Now, this was done in addition to the quarantining that's already going on. And right now, precious days have gone by and we still have not seen a finalized list, and we have not seen residents shuffled around as the state tries to avoid an outbreak among the most vulnerable population. You're going to hear about the latest in Milford first, and then the latest on the nursing home shuffle next.
Our Department of Public Health professionals have been in daily contact with the operators at that facility via FaceTime. They've been on site recently and ensuring that they have the adequate infection control procedures being implemented, adequate staff.
We'll be announcing the first 3 COVID-only nursing facilities in the next day or so. And that's what we're doing in a very strict way to mitigate the spread of this in a very contained environment with the most vulnerable population.
And another controversial topic has been essential work. We've heard from many people in different industries wondering why they are still working. And the governor laid out some of the guidelines on that. Right now, he says if you're in manufacturing or a warehouse, you need to be 6 feet apart from your coworkers. And also, upon entry, your temperature will be taken for self-monitoring. Anyone who is over the extremely high number of 104 degrees will be sent home immediately. Dennis?